Good afternoon, everybody. Welcome along to the joint board meeting today. This meeting has been held remotely and will not be filmed live, but will be recorded as a subsequent broadcast available through the council website. The Integration Joint Board is a joint data controller with Inverclyde Council and NHS Greater Glasgow Clyde under the General Data Protection Regulations and Data Protection Act of 2018. This meeting will not be broadcast, but will be recorded for our public task obligation to enable members of the public to observe the democratic process. Data collected during this remote meeting will be retained in accordance with Council's public policies available through the Council website. Members of the Integration Board are reminded they should follow the IJB's established meeting protocol, including the round of the use of chat facility and other comments made. The chat facility available to all participants in which the meeting, which may include members of the public and also who received an invite. Thank you. First thing, the agenda. Diane, apology to substitute declaration of interest.
We have apologies for absence from Minister Lynn Quinn, Councillor Sandra Reynolds, Kate Rocks, Laura Moore, Stephen McLaughlin, Dr MacDonald, Margaret Tate with Don Quaid substituting, Charlene Elliott with Vicky Cody substituting. Chair will now move to a roll call before asking for declarations of interest. The following members please indicate they are present at the meeting either in person or remotely. Councillor Moran.
And present.
Alan Cowan.
Present.
Councillor McCluskey.
Present.
Anne Cameron Burns.
Present.
David Gould.
Present.
Dr Metcalf.
Present.
Jonathan Hines.
Present.
Craig Given.
Present.
Dr Chris Jones.
Present remotely.
Gemma Eardley. Leanna McCrone.
Present.
Vicky Cody.
Present remotely.
Donald McQuaid.
Present.
Heather Davis.
Present.
That's it. Are there any declarations of interest?
Sorry. Please, Chair.
Jonathan.
I need to declare an interest in item number 14 on today's agenda, Chair, so I propose that I will absent the chamber when the item is called. Comments from the IGB will be able to talk to that. Right.
Okay. Move on to the agenda now. Agenda item number 2 is Inverclyde Integration Joint Board, Monday, 13th of May. Everyone had a look at the minutes and then we aim to bring up in the minute of the meeting. No, right, I have to accept the minute of the meeting. Agenda item number 3 is Integrate Joint Board voting membership update and sign off.
Thank you, Chair. The purpose of this report is to advise the IIJB of a change to its Vice Chair position. As members know, the current IIJB Vice Chair is due to step down as a member of the IIJB and as a non-executive member of Greater Glasgow and Clyde NHS Board on 30th June. This year, while the recruitment process is ongoing for a replacement member, the NHS Board has reviewed its non-executive board member responsibilities on the IIJB and has agreed a change to the IIJB's Vice Chair arrangements, and that will take effect from the 1st of July. It's recommended, Chair, that the Inverclyde IIJB notes the appointment of Greater Glasgow and Clyde NHS Board of David Gould as Vice Chair with effect from 1st July 2024. Members will note in section 4.1 of the report that the current Vice Chair of the IIJB, Alan Cowan, is due to step down as a member of the IIJB and as a non-executive member of the NHS Board on 30th of June. And the NHS Board has confirmed that recruitment will be ongoing in order to replace Alan on the board. Thank you, Chair.
Okay, everybody happy with that? Agenda out of board, Craig, is draft annual accounts.
Thank you very much, Steve. So, Chair, first of all, just want to take the opportunity to thank the finance team for all the excellent work that's been done in the completion of the draft annual accounts. I also want to thank the various service departments and the team for the information for allowing us to present this document today. As you will know, this is a very complex document, so let's spend a lot of time going through it page by page. Just wanted to take some time out to focus on some of the main highlights in the document. Our bottom line revenue position is highlighted in the accounts, and it is an £843,000 overspend. This is split 444,000 in social care and 409,000 in health. The main reasons for overspends in social care have been due to overspends in children and families care placements, and we've been reporting this all year. This has been offset to an extent underspends in adult services, care packages, and vacancies against most of the budgets in the social care element of the budget. On the health side, the main overspend is due to pressures in prescribing budgets and mental health and patient provision. This year, it's been offset by underspends mainly in vacancies. A full analysis of these variances can be seen on page 10 of the accounts. When we started this financial year 2024, there were a total of £24.262 million in reserves, and at the end of 2024, we now have £19.287 million in reserves. And this is the reason why the accounts show a net deficit of £4.975 million. And this is purely due to us using a number of our reserves during this financial year. And as I said at the beginning, we still have over £19 million in reserves, which will help us going forward. Most of these reserves are allocated to specific funding streams, but IJB members should note that included in the reserves, we have nearly £6 million of smoothing reserves and general reserves. And these are the reserves that will help us with a 2-year savings plan, which we approved in March of this March IJB. As is normal, as part of the standard accounts document, we've highlighted in pages 8 and 9 of the accounts the final year-end transfers to reserves and the final drawdown of reserves to cover the year-end overspend, and we ask the IJB to approve this today. Page 19 shows our annual governance statement and highlights again that the system of governance and internal controls that has been viewed by internal audit has been satisfactory, and this was mentioned earlier on that in our report of IJB Audit Committee. For those, obviously for timing, I won't go through it every area in the accounts, but I feel this is still a strong set of accounts with a strong reserve statement, and this will help us address the pressures and priorities in the coming years. And as always, happy to take any questions or comments you might have.
Thank you, Craig. I did we get an opportunity. I know that the Pope was kind of late to go through it. Again, we get any questions for Craig on the financial report? I don't see one here. Okay, we have to accept the report. Great. Number 5 is the road actions, and again, Craig.
Thank you, Chair. As enclosed, this is our own action list, and it's a standard report we forward each cycle, and it shows all the main reports and units that are dealing with the working over the coming year. As always, I'm happy to take any comments or questions you might have in this content.
Anyone, any questions for Craig on road action? Nothing online. Okay, ready to know that report. Number 6 is Inverclyde Integration Joint Board and IJB Audit Committee proposed date for future meetings. And
Thank you, Chair. The purpose of this report is to keep an even a timetable of meetings for both the IIJB and the IIJB Audit Committee for 2024-25. Members will see in Appendix 1 to the report the proposed timetable. timetable relating to 2023-24, and it's recommended that given to the timetable meetings for 2024-25.
Anyone? Question? Happy with the dates? Okay.
Chair, sorry, apologies, I should be flagged up that the appendix 1 refers to the timetable for 2023-24, and I'm told that that's in fact incorrect and it should refer to 2024-25.
Right, thank you. I'm sure God knows. Item 7 is the ADP annual survey, and Katrina.
Thank you, Chair. This is a briefing paper just following the October Partnerships Annual Survey, which we are required to submit to the Scottish Government annually. Prior to submission, it has to be approved by both the ADP Committee and IGB. We've already had approval and the ADP Committee, so I'm bringing it here today for approval by the IGB. The main aim of the survey is to consult progress against the national mission by providing a note of our activities within Inverclyde as a result of the work carried out across the ADP. The annual survey official statistics report is scheduled for publication in the autumn, and the gathers local information relating to the structures in place to inform surveillance and monitoring of alcohol and drug harms or deaths, a resilient and skilled workforce in our ADP, linked and development experience, stigma reduction, fewer people develop problem substance use, risk of reduced for people who use substances, people most at risk of access to treatment and recovery, and people receive high quality treatment and recovery services. Quality of life is improved by addressing multiple disadvantages and children, families and communities affected by substance use are supported. So I haven't planned on going through the important survey, but I'm happy to take any questions or anything.
Thank you much, Katrina. Councillor McCluskey.
Thanks, Peter. Just in relation to question 38 in the survey on page 52 is about support services in place for children and young people affected by a parent or carer substance use. And I'm just conscious that in the up to 12 years, we aren't ticking any of those boxes. I'm just wondering if is that because services are being provided through other means, not through the ADP, or are we just not providing services to those kind of much younger children?
Which money should come through children's services, and we provide to much older age group and adult population.
Just on that, well, maybe Jonathan might, I don't know if Jonathan would have something to say about that in terms of what support we're providing to the up to 12, but if it's in the ADP questionnaire, is this because in other parts of the country it's being provided in a different way? Or right, okay. Okay, Jonathan.
Jonathan.
Thank you for being here. Through you. As Katrina has said, the responsibility locally for providing those support services to children and young people affected by substance use would be through Children's Health and Social Work. We do have some specific provision around young people's drug and alcohol workers, and the model may vary depending on the state of integration from location to location across the rest of the country.
Right, Jonathan. I'm just wondering that in terms of, obviously this question exists in this survey from the government for a reason, so that presumably we and they get to see what support's on offer for those groups. And I suppose the way it's presented at the moment makes it look like we're not providing any support, which obviously isn't the case. And I'm just wondering how you reflect that, and also, the flow through to the board.
I think there is an ability for us under other, and I'm happy to back to that before it goes back to the Scottish Government.
Brilliant, thank you.
Dr. Metcalf.
Thank you, Katrina. I was going to ask about question 18 of the report, page 38, where they asked about harm reduction interventions. And I appreciate that the demand may not be known at the time, but just given the level of drug deaths, obviously, that we've seen in Inverclyde that reported in 2022, and the rate observed nationally in Scotland, and what they have listed here are
kind of nationally recommended evidence-based recommendations. I just wanted to put it was an opportunity to highlight that there actually may be demand for these interventions within Inverclyde, albeit not currently delivered.
So I think it's something that we as an NDP need to consider going forward. It's not something that we're currently providing. We know that we've got the heavy assisted treatment and obviously the safer drug consumption facility in Glasgow at the moment. So there is opportunities for us to discuss accessibility because there is a board-wide alcohol and drugs approach, but it's not provided specifically by our ADP. So I guess what I'm saying is, although we are not currently providing this through the ADP, it doesn't mean that it's not being provided or as a whole.
Yeah, I see what you mean. I suppose I was wondering, is this an opportunity to highlight that there actually may be a need for that locally?
Yes.
And we could maybe highlight that yes, we have it, but it's Glasgow, and particularly for this group, perhaps not accessible, but it could. These are things that could really benefit our local population.
The climate change of the ADP to see how we plan that in going forward.
Thank you.
Thanks, Chair. Thank you, Sheila. Can I maybe ask a question about question 6, please? That's okay. Just looking at resilient skilled workforce question here. I'm just trying to get a background in that. Do we have enough people to do this, the work we've done for Inverclyde? I'm noticing we've got 2.4 full-time equivalent total staff. It says total vacancies of 1, and then if you go over the page, there seems to be considerably more than 1 WT. So I'm a wee bit confused by that. So where are we staff anyway? Do we have enough people, or do we need to get more people in to actually deliver this more effectively?
So on page 29, that gives the current establishment.
Okay.
On page 30, it gives the current post because we've got a number of staff long-term vacancies, and we've done a bit of restructuring around ADP support, and that is ongoing.
Okay.
I would say to you though that is the support to the ADP. That's not all the staff that actually contribute to the ADP. And we've got people across our ADRS services and our mental health services that also contribute to our working with effective partners. So that is basically the administration behind the ADP. But page 30 reflects what's actually in post at the moment.
Okay, so again, here's my follow-up question: you don't feel we're exposed in terms of not having enough people who have got the right resource in place at the moment, subject to it? Okay, that's great. Thank you.
Al?
Yeah, thanks, Katrina. So I'm looking at question 32. You're getting these batted at you quite quickly from all over the places. And I declare a program just. I'm asking the question as a veteran, and the veteran category exists in that in the question I'm going to ask. So I can see there are 11 groups there where the question is related to about specific treatment and support services for discrete groups, and we offer that opportunity to two discrete groups, folk that are homeless and women. For other 9 groups, there are no specific services. I'm assuming that there are just general services. So there are services that are not specific.
Yes.
And this is my declaration, as it's probably is valid. So the veteran group is a well understood group in terms of its the risk to drifting into alcohol and drugs. And so I just wonder if in the ADP any discussion has been had about whether there's a need for a tailored approach to that group that would improve the outreach and often the outcome. It just strikes me as a veteran declaration that that's a group that stands apart from the others of being at a particular risk. And we have made arrangements for some other categories, but we haven't for that. That looks a little bit odd to me.
Yeah, there hasn't been any discussion today. However, I've managed to join the GGC-led veterans group, and that is something that we will look at across all of our services, not just our alcohol and drug or what we might support through the ADP. But we're making the links to Inverclyde to that wider group.
Thank you very much. I just think that group in particular, given that we have particular services, particular groups, seems to me to be one that we might spend some time thinking about. How can we do better to reach that group? So thank you for the assurance you've given me.
It says that it recommended IJB review the ADP annual survey and approve it via the ADP team, submit to Scottish Government by the required deadline. You make some changes to this report, take the comments, or call it down the table.
Absolutely.
Okay, that's really right. Anyone else? No, I don't get no line. Right, thank you, Chair. Number 8 is Inverclyde HSEP Savings Programme Board. Craig.
Thank you very much, Chair. The Inverclyde report is a savings program board update. It's an actual follow-on from the savings exercise that was done in the 2-year budget that was set by the IJB in March of this year. The report highlights the overall savings working groups that we've set up, along with the various working streams created to deliver the overall savings. Please note that all the individual savings working groups have been set up and note terms of reference enclosed, which show the makeup of each of these groups, highlighting all the important stakeholders who will have an active part in the delivery of these savings across all areas. As we progress through each of these work groups, regular updates will be brought back to the IJB along with relevant recommendations and, where required, updating the quality impact assessments. So a number of these have already started, and we've already had our first group as such, and they're progressing relatively well at this moment in time, but please be assured that IJB will give full updates on the progress of each of these savings. But as always, happy to take any questions or comments from anyone.
Councillor Busky.
Thanks, Robert. Just a few questions, Craig. Thanks. Just first of all, on the timelines for this. Obviously, it's a 2-year budget, and the whole thing needs to be delivered over the course of 2 years. Is there any more detail in terms of when you would expect us to be making decisions or seeing results from some of these groups? That's just the first question. Secondly, just on the general governance arrangements of this, just so that we as board members are kind of clear about what's coming back to us. So obviously we've made a decision in terms of the overall budget, and that's in the hands of these programme boards now. Presumably the decisions that have been made, and that this is just now a case of delivering the savings, which then, I'm seeing you nodding, that was then leads to the kind of final question, which is, if there is an expectation that maybe the savings aren't achievable or this is running up against any issues, would we expect to see things back sooner rather than later so that the board can then take a view on how we deal with that? Or is that something that would be totally dealt with at a sort of management level? Thanks.
Through yourself, Chair, the easy answer to that is yes, we will be bringing back any issues or anything you're encountered as we go through that. And full transparency for the IJB, so they see the full decision making it's been doing. So, and it kind of leads on to the first question you asked there as well. The answer to that is from the next cycle onwards. As you can see in the report, we've already highlighted where we've been able to get some of the savings already. So I suppose it's just to say it's a continuous thing that we're doing. So we'll be looking to bring forward a report pretty much every IJB cycle on it.
Great, thanks, Craig. Just one final question on a different issue within the paper, which is just the pharmacy review that's obviously been added presumably because of the pressures on prescribing at the moment. Just because I don't know all the individuals that are listed here, who's the pharmacy voice in among the pharmacy review? I can see Hector's name, but is Margaret Maskery, is she the pharmacy voice?
Through yourself, Chair, yes, she is indeed.
Right, brilliant. Thank you. Thanks very much.
Dr. Metcalf and David.
Thank you. I just want to ask a similar question on the pharmacy review. Just, do you have detail yet on whether that team will, is this purely about medication prescribing budget, or will it go further to look at pharmacy staffing models or service models?
Through yourself, at this moment in time, it's purely on the prescribing and the actual drugs as such. But I suppose with the level of savings that we're looking at, these are taking that side of things. But in terms of transparency, as we said with the other ones, we will bring regular updates so that everything is disclosed at the time.
Thank you.
David.
Thank you, Chair. Thank you. Just a very simple one. In terms of actually utilising the savings, based on the information you got at the moment, are you on target to do that? Or do you have any concerns at this point in time?
Through yourself, Chair, as is always the case here, we're working really hard on it. We, from what we've seen already, we're confident as we possibly can be. The work groups have started and they've been well received from what we can see. So you can never say never with these things in terms of delivering a £5.2 million savings scheme. But from what I've seen as Chief Finance Officer, I'm relatively comfortable at this moment in time.
Thank you. Well, Paul, I'm just saying, this is probably one of the most important pieces of work I've had to undertake, as a board, to look at this level of efficiencies. And it really is good to see our trade union colleagues have joined this process, and any decision, hopefully, we have to come to, we'll do with their input. It's very, very important that we take the actions of everyone who works for us, and I think that's the people will represent their views on it. So it says here, notes the plan in terms of reference to the saving board, notes an update report we brought to each IJB where relevant. So that relevant that every IJB or every two, depends on the relevance of the saving.
If I can talk to you, being relevant part out of it, and they will bring full transparency.
I think that's kind of cleared up for us, Craig. Thank you. So with the form of work. Anyone else got anything on the programme? Right. Okay, we know second is that report. Number 9 is the joint inspection of adult service integration and outcomes spoken to people living with mental illness. And Jonathan.
Thank you, Convener. Within this report, the inspection report, the joint inspection of adult services report, is attached to Appendix 1. And just a reminder to board members who we previously advised the inspection was underway. The report was published at the beginning of May 2024. The methodology of this inspection had been structured around how effectively the partnership delivers seamless services to achieve good health and well-being outcomes for adults, but the focus was very much on people living with mental illness. The inspection process led to evaluations for the partnership against 5 key areas, and they are listed within the report around key performance outcomes, the experience of people who use services, delivering key processes, strategic planning, policy quality and improvement, and finally leadership and direction. The partnership received 3 good evaluations and 2 adequate evaluations, and within 3.6 of the cover report, a summary of key strengths has been provided, and inspectors noted within that that people have generally positive experiences of health and social care services, which contributed to improved outcomes for their health and well-being and quality of life. They noted also the partnership's vision focused on inclusion and compassion, and very much reflecting the investment in early intervention and prevention approaches, as well as a collaborative culture across the partnership, which really built on the long-established integration arrangements within Inverclyde, and it also followed on the robust commissioning processes in place. The inspection, as you would expect, also identified a number of areas for improvement, and these are noted within the report, particularly building on those feelings of people being supported to attend reviews, but noting that there could be some improvements around people's understanding of their choices, particularly linked to self-directed support and other ways to promote independence for some people around choice. The inspection also identified the need for improved management and governance of statutory social work services for mental health, and certainly the report acknowledges a number of those changes were already taking place during the period of inspection. Overall then, managers have completed a post-inspection feedback questionnaire following preparation of the final report, and that was really our opportunity to feedback to the Care Inspectorate and Healthcare Improvement Scotland about the experience of inspection itself, to assist with their learning in terms of their developing methodology, but also we followed this up with an improvement plan which draws on the findings of the inspection itself and also some of the ongoing improvement activity which was already underway. Progress against the achievement of the improvement actions will be reported to the Clinical and Care Governance Group, and also to the IJB audit committee for monitoring of improvement activity. Members will appreciate that this is quite a comprehensive report, that in fact the footprint of the inspectors was across 7 months, so there was a lot of activity locally and a lot of detail in the findings. So to that end, it's intended to have a development session for IGB members at a later date, which will provide the opportunity for a more comprehensive consideration of both the inspection process and the report, as well as improvement actions underway, and we're hopeful to have representation from the joint inspection team there as well. So happy to take any questions from here at this time.
David?
Thank you, Chair. Jonathan, I'd just like to say this is reflects really good work. I'm happy the team, it's good to see that report. It certainly gives me a lot of confidence. The only simple question I have is in terms of the improvement plan, when that will then come to obviously myself as chair of the committee, and prior to that the clinical and care governance forum as well. What's the sort of timescales for that? So we actually decide all the improvement plans.
Thank you, through yourself, convener. We would intend to bring the improvement plan to the next meeting of the audit committee, and the clinical care governance group has just been within the last couple of weeks, but it will be going to the next meeting as well.
That's great. Thank you, Jonathan. Thank you, Chair.
Right. Al?
So, just based on my broad experience, I'm just thinking that these things tend to have a moment in time when they're current, and other things will come along and bite us, or challenges around the time that we need to devote to things. So, I'm just giving Jonathan an opportunity to come back at me here. I wonder if the fact of having a development session, we haven't tied it to a time frame. And also, as the main board, we've delegated much of the looking at to the audit committee in the first instance. So I think it would give the main board just a wee bit more assurance if we had a wee bit better understanding of when that development session might come along. Because I think as time goes on, they'll forget that you briefed it in. They didn't read the, so there's almost a need, I think, for sooner rather than later. So just giving you an opportunity to come back to me on that.
Thank you. It's yourself, convener. We're actually currently looking at diaries to schedule that for as soon as possible for members.
Thank you, Chair.
Yeah. I must say, and I read the report myself, and I was just a layperson, thought a lot of contradictions in it, quite honest with you, But I want to congratulate the team for the work they've done to do that report. And I think it was kind of what we were expecting, the inspection would be about. So that was another thing, So I think it, all in all, it's a good report. And I want to thank the staff personally for the amount of work that you've been to get that report. So anyway, this is here, go to publication of inspection and attention of some activity, go to planned development session for IGB members, which we spoke about here, to more fully explore the inspection report and improvement plan. So I think that's all on hand, John. Thank you. 10 is the HSCP workforce plan progress report. Craig.
Thank you very much, Chair. This is a workforce plan update, and IGB are asked to note the updated workforce plan. This has now been in operation for over a year. The IGB are asked to note the current progress of each of the various work streams, and asked to note the current badge status against each of the updates. We're pleased to say that we only have one which is currently at amber, and we're actively working through this. All services are represented to date, and happy to take any questions you might have on it.
Anyway, any questions on this progress? Diane, and then David.
I'm a bit disappointed that as a workforce plan, it hasn't gone to the Staff Partnership Forum before it comes to the IJB. And it always used to be that sort of staff governance was something that the Staff Partnership Forum specifically dealt with, and then would go to the strategic body. I know it's on the agenda for Friday's meeting, but I've just had to ask for that. So,
Thank you, Diane. Craig?
Yeah, I'm happy to come and say apologies from our side. It's just really been a timing thing for us. But obviously, we've now got that. I'm happy to take that along on Friday to the Staff Partnership Group. So we can discuss on that side there. But Apologies for the time over.
Thanks, David.
Just a very simple one, Chair, just on page 125, 3.3, you stated there was two, Sandra, but it's only one. So you'll do yourself a disservice.
Again, apologies about that report. We did see that, but I think we got through it, so it should always put it on, so apologies to everyone for that.
Any other questions? Okay, right, we agree with that. The next annual progress report, year 2, will present again at the board in November 2024. Correct, Greg? Okay. Right, agree with that? Good. Number 11 is the Chief Officer report, and Jonathan.
Thank you, Convener, and in its absence, I'm pleased to bring this week's Chief Officer report to today's meeting, and it provides some information on activity related to performance around delayed discharge, where it's good to know that fewer people have experienced delays in being discharged from hospital in the same period last year. Last month saw 307 days lost, which was actually the best performing month since January 2022. And the report also provides some more information on board-wide activity to ensure a consistent approach to reporting delays. There's also a brief update around our regular review activity related to policies and procedures, and that aligns with external audit recommendations. Members will be familiar with the work of the Lens project that was developed last year with Children's Services, but that has been progressed now with Adult Services as well. And at 4.3, an update is provided on work to take that forward, with a similar model of a provision of £50,000 transformation fund to develop ideas for action from the frontline workforce. In fact, the final investment event took place at the Beacon just over a week ago, so that marks a significant development in terms of taking those ideas into action to deliver against those over the next year. Similarly for Children's Services, with the Lens project, there were 4 projects that received investment at the end of last year, and the practice pad is the first to launch. We had hoped that it would launch on Friday past, but there's just been a slight delay in the final arrangements, so that will go ahead within the next few weeks. But there is detail in Kate's report about the focus of that being very much to support young people moving towards independent living and learning those skills of living tenancy and having the confidence and the skills to live alone. And we've looked on that with a formal qualification for them as well. And finally, after the local HSCP staff awards held earlier this year, I'm delighted to confirm to anyone who didn't know that Aileen Wilson, who's our residential services manager in Children and Families, was successful at the board-wide staff awards ceremony last month, where she received the overall staff award for Leader of the Year. As manager of our Children's Residential Services, Aileen has a lead role in developing the practice plan, but also looking at how we can work to bring more children and young people back to Inverclyde from external placements. So just in closing with my final comments, it's certainly a fitting tribute to one of our own leaders across the health board area. So I hope that helped is helpful. Can be not happy for any questions.
Hi, Anne. And then David. Put your light on.
Sorry.
That's a good indication you want to speak.
I was going to ask you for some more details about Lens. It says adult services. I thought that was like health and community care staff in particular, but did that cover mental health services as well? And if the event took place on 13th of June, can you tell us what were the winning proposals?
Thank you, Dan. I'm going to pass to Alan, who was in the middle of that process, so I'll
Yes, right, Alan.
some more information. Thank you.
Thank you for yourself, Chair. Yeah, we did actually, we made a decision in terms of adult services, we put that across both health and community care, and we put out to colleagues across mental health and addiction services, so that went across the full gambit of adult services. In terms of there's a lot of really good ideas. It was really heartening to see colleagues really embracing this and picking up on the learning that Jonathan said from the work that was done across Children and Families. And I'd say that the adult service picked up on it as well. But we had eventually five main pitches, a community first, about engaging with our community, one around diabetes prevention support programme, an inclusive digital support planning, working with service users with a learning disability about how they actively take part in their own reviews and really at the centre of reviews and taking a really good part in that. We also had what we call a pitch around called Little Acorns, and that was about supporting women with in terms of the homelessness service, supporting as a specific issue there. And finally, a very interesting one about an inclusive radio project, again based around service users with additional needs taking part in owning their own media radio station. So unfortunately I never made the event, which I'm really annoyed about, but I gather it was really well received by all that attended, and it's a really good springboard into the future about how we take these kind of initiatives forward from the sort of grassroots up.
David, and then Martin.
Thank you, Chair. Just a comment and then a question. In respect of the business items 4.1 delayed discharge, this is a great achievement for us, I have to say. That is a really big win in terms of reducing the number of event days lost and delays in patients being released as well. I think this is something we should absolutely celebrate and be proud of. And one thing, in terms of what we're actually doing to achieve this, is there any sharing of information with other IGIBs within the Health Board family in terms of what we're doing is clearly working? So could that then translate into what the challenges they face as well? So just something to consider, really. Thank you, Chair.
For yourself, Chair. Yes, as always, we work on a daily basis with all our partners across Community Acute, but also the wider HSEPs and also nationally as well. Where something works for us, we're keen to share that, and likewise other colleagues in other areas have shared with us as well. We've seen our performance, and remember there's a person at the centre of this. We're trying to ensure that they're getting to the correct place as soon as possible and supported in the most safest way. We are seeing our the benefits now coming off the care and support at home review that the IGIB has head off previously, that we're seeing the benefits of that. So yes, there is a national piece of work. We know the First Minister has raised the issue around delayed discharge as well. So yes, sharing the data, sharing the intelligence is paramount in achieving this.
Thank you very much.
Martin.
Thanks, Robert. Just two questions. Firstly, on delayed discharge, really good to see what's in the report. It feels odd sitting on a warm day talking about winter, but if we're to roll forward, I know that winter planning happens all year round now, but if we're rolling forward a few months as we get into the winter, in terms of what we've done and what it says here in terms of culture, joint working, communication, correct discharge planning, will that be sustainable as the numbers start to rise? Is basically my question on delayed discharge. And on the second thing, if you indulge me for one moment, this is something that's not in the paper, but I do want to ask about, and I would have asked Kate if she was here. It's just around a topical issue at the moment. I'm conscious we're not going to have another meeting for a few months, is on dentistry. There's obviously been another closure of a local dentist, and we have the situation at the moment where we don't have any open roles for dentistry in Inverclyde. Across the Health Board region, and this isn't a criticism of people present here, but it doesn't feel like there's enough urgency in the Health Board in terms of addressing the issues in Inverclyde. I know we've been over this in the past, but what are we doing? What's the Health Board doing to address the fact that a lot of people in Inverclyde now no longer have access to an NHS dentist because it's just storing up problems for us in years to come?
I think Marty would be a bit naughty there, bringing up. It's on the agenda. So I think you have to give the officers an opportunity to think if they can answer, if not, come back later. But we certainly can talk about delayed discharge.
Thanks for yourself, Chair. Yeah, you're right. Winter happens effectively all year round, as we know. But at the moment we are in a good place, but we will be challenged in the winter period. But I think we're in a much better place now in terms of all the work that we've all collectively done. I think where we'll see the main issues around where service user patients there's issues around adults with incapacity and about that process. That will be our pinch point. But as I said, I think we're in a better place, but that's not to take away from the fact there will be a challenge as we come into the actual winter months. And again, as we've mentioned before, this is where the importance around some of the vaccination programmes is paramount to where we can prevent unnecessarily admissions, is to make sure that folk who are appropriately vaccinated and continue that message. But it's something that it's not even on a daily basis we discuss, it's literally 2-3 times a day we're pulling key members of staff together to sort of monitor where are we going with this. In terms of the second issue, I'd be happy to get back on what we're doing locally for that information, and we can get that discussion.
Quite happy to give them an opportunity to come back to you. Okay.
Yeah.
Right. I'd just like to say Alan and I were judges on the Lens project, and it was absolutely amazing to see the amount of talent, within the organisation. But more importantly, it wasn't just managers. The young chap who the idea of the radio is a carer, and he's seen there was something missing for the people he cared for, and he thought he could help to do that. And it was just amazing for him coming along that day, pulling his phone out and giving the presentation. It was absolutely fantastic to see that, and I'm really glad that we decided that we should get the funding to take that project forward. The rest of the projects were fantastic as well, and sometimes we don't see there's a need, and some people or staff on the ground do. And I'm going to talk, the diabetes one as well, which is something somebody speaks about, pre-diabetes, 2 diabetes, and again it was fantastic. But they were highlighting that a need that was out there, probably we didn't realise. So I think it was a fantastic success, and I hope going forward that maybe can get somebody else to go on the panel and they can see it for themselves. So thanks very much for that.
Can I make one comment, Chair? Maybe just worth reminding colleagues, this is money that's portioned to the IGB for transformation, really wide ambit there that we could spend this money on, and it's kind of sat in, I guess, spreadsheets in various columns and attributed to X, Y, and Z, and it slowly seems to flow out and do stuff. And I think the officers last year bringing forward the idea that they would take a limited amount of funds to the staff, invite the staff to tell us what they thought could be done in these areas, persuade us that it was our priority, listen to the pitch, and then discuss with ourselves how we would rate them against each other to squeeze the amount of money they want into the amount of money we had. Is an ambitious new thing to do. We've done it now twice, as you've heard. And I just think it does give the activity a whole staff-led feel. I think that can't be a bad thing. We couldn't give you the 220 million that we get, but we've got a fairly small amount of money which is for transformation. And it just, as Robert has said and others have sort of echoed, it just seems to be the right sort of thing at this time, is to just take a step back and say to the staff, look, tell us what you think is reasonable. What could we do here? How much would it cost? What would it look like? What does a pilot look like? How much would that cost? What would you measure? How will we know? So we've gone through that process on behalf of the board and come up with last year 4 or 5, this year 5 projects. All of those have then had to be pitched to us by members of staff. That means their time and effort, levels of persuasion, asking some hard questions, getting some good responses, and then deciding that there's no great risk in this. And the oversight comes from the executive team who look at those projects as they go forward and judge that they're going in the right direction. I think it's a great idea.
Yeah, it's a good idea. Hey, thanks, Martin. Who's the rest? We get into the private session now.